Traveling full-time without a home base is not an excuse to neglect your health. We traveled to Chiang Mai, Thailand in order to take advantage of its high-quality medical tourism. We did full health screenings over the course of several days, and we share everything you can expect and look for if you're seeking proactive health care while traveling.
Welcome back to Find Gina Marie, where we share our lives as full-time travelers and the connections we make along the way.
If you're new here, welcome. I am Judy.
And I'm Kevin.
We're delaying our first episode from Cambodia in order to bring you with us on our healthcare experiences while we're in Thailand.
It's been a very short week. We've had a lot of appointments. We're going to talk about those in just a minute.
Please subscribe if you haven't already so you don't miss any of our exciting episodes from Cambodia, which we loved. Spoiler alert.
As one gets older, it's important to be proactive about your health, and we're very aware that even though we're traveling full-time, we do need to take care of our regular health appointments and checkups.
And although we've only been on the road just a little longer than a year, we didn't really have time to get these appointments before we left the United States.
It went from a vacation in Italy to let's just go.
But we did make a decision that we were going to get healthcare while we were in Thailand because it seemed like a good place for medical tourism.
Yeah, this wasn't a spur of the moment thing. This was fully planned, and part of the reason why Southeast Asia was a place to go for us.
Technically, we could have had all of this done when we were in Serbia as well, which is also a place known for medical tourism. But we were so focused on getting Kevin healthy that we really didn't want to muddy the waters by getting other things done at the same time.
Yeah, and I wasn't as mobile after I had surgery, and you had your hands full trying to take care of this guy here who was hobbling around.
So let's dive into exactly what the process was. First, I'll say that there are two hospitals in Chiang Mai that are recommended. The first is the Chiang Mai Ram Hospital, and the other is a brand new hospital called Bangkok Hospital, Chiang Mai.
The Chiang Mai Ram Hospital also has clinics near it, which is where we did a lot of our testing.
And is a little bit closer to our Airbnb, and the prices also were a bit lower, which factored into our decision to choose that place over Bangkok Hospital.
And as you'll see, it was really good that we chose a close place because we walked there multiple days in a row.
We scheduled our time so that we would be in Chiang Mai for a month. And as soon as we arrived, I sent an email to Chiang Mai Hospital to find out what we needed to do to get an appointment. And really, they responded back the very next day saying we didn't need to do anything. We didn't have to schedule an appointment. We could just show up.
It's checkup day?
Yes. We're not getting any younger, and just
What?
for the sake of making our health a priority, it's important that while we're on the road, we kind of get a clean bill of health before we take our next steps of traveling. And I have had skin cancer in the past. I think I have something suspicious on my face that they need to look at. Probably are coming here to get that removed as well while we're in Thailand.
Yep, and just general physicals. Make sure everything is in working order and there's no abnormalities. Anomalies? Abnormalities.
And I think we're also planning to get some vaccinations while we're here for some of the places we're going to be visiting in the next year. So
One day.
come along with us.
Yeah. Checkup center. Is this it?
Yep.
Anti-aging? Oh, I could use that. How much anti-aging can they do?
Roll us back 10 years or more.
Yeah.
As soon as we walked in, somebody was there to greet us and ask us what we were there to do. We handed our passports to them and said we were here for a health screening. We didn't have to wait for an unreasonable amount of time when they called us together to go and discuss what kind of package we wanted to have for exactly what screenings we wanted. The hospital has an assortment of different kinds of healthcare packages. You could get just stroke screening or obesity screening or any number of things, cardiology.
All a la carte, yes.
And they had programs that were their standard healthcare package, and those were general tests. So there were 3 different segments. One if you were under 35, 35 to 45, and then 45 and up.
With the last set, the premium grouping seemed like it had a few tests in it that I didn't necessarily need, so I chose the advanced grouping, which meant that I was kind of in the 45 age bracket, which Total lie, complete lie.
And just to baseline, Kevin is 61 and I am 59. There were some things missing from the advanced, and Kevin went ahead and chose a la carte to incorporate those in, which they allow you to do.
So I added in the PSA for the prostate cancer testing and also a vitamin D test because I didn't see that was missing, but that's certainly something that's important for both of us. And then we also got boosters for our Hep A and Hep B.
I chose not to get a la carte. I went with everything that they suggested for my age bracket. One thing that I was a little concerned about was that my pulse has been running kind of low, and I've been getting warnings on my Apple Watch. And so I wanted to get that looked at, especially because I'm adopted and only recently did I find my birth family. And I learned that my father's family has had a very robust history of heart disease. And so I just wanted to make sure everything was in order with all of that. So once we'd finalized the full menu of services we were going to get, they sent us back to the waiting room and then eventually called each of us separately, and we were off to the races. My first stop was to get blood work.
And I had a vitals test, and my blood work was also next after that. I felt like I was moved through my process much quicker than Judy. And in fact, I was kind of concerned that you were still stuck at stage 1 and I was already in the second waiting room waiting for my next battery of tests.
Right, because you had also gotten your vision test, and they did say that Kevin was going to be finished at around noon, and it was going to take me until around 3 o'clock. And that is really pretty spot on about how long it took. So we stayed in contact with one another either through text messages or we met up in the back waiting room, and that worked out pretty well for us to kind of keep on track with where each other was.
Now, there was one point in the process where we both had to get into gowns that were supplied by the hospital, and our phones also went in the lockers that we put our street clothes in. And dead air as I'm trying to figure out where Judy is, or she was trying to figure out where I was. Other than that, I thought it was pretty easy to stay in contact with each other.
I'd actually recommend that you don't put your phone in your locker if you're keeping up with someone.
Day 2 at the Chiang Mai Health Clinic. We're getting our results for our checkups.
So yesterday, I got the entire slate of premium health checks based on my age.
Only the best for you.
And that ended up being, we'll put prices all at the end, but it meant that we arrived at almost 8 a.m. and I wrapped up about 3 o'clock. So it was a full day of testing. What about you?
And my testing got finished a lot earlier, and not much of it was sitting around and waiting, but there was some of that, and they had different waiting areas in the clinic. So overall, it was a good day, and my testing seemed a lot less invasive than yours. I didn't certainly have the laundry list that you had. I thought it was a decent experience. I felt a little hurried and rushed out of certain spots.
It was definitely, they had like an assembly line of how they were going to get you places. Unfortunately, they did have somebody that was not the same person always, but somebody always was designated to walk you to the next destination, because it was a long series of tests that we were getting. And each time we would go to a waiting room. So sometimes we would meet up and that was kind of nice. And we could like compare notes to see what Kevin got done versus what I got done. And
because it was a long day, they did give us snacks at one point. Mine came earlier. Mine was sweeter though. She had the protein snack.
Yeah, because I was there like past lunch. But we'll see what's happening today. We have a few more follow-on appointments that weren't included in this package price, but based on certain things, we knew we wanted to get checked. So
yeah, and we did get our Hep A and Hep B boosters, which was really nice to get those in.
Yes, and it did unfortunately lead us to having maybe a less ideal evening. I think we were both exhausted by the time we were finished. In fact, we grabbed some food right when we were done, and then we actually took a nap at 6 o'clock at night because we were just so whipped. But I'm sure that the
between the shots and the process of hanging around in a health center all day long, but overall a good experience. Not bad at all. Talk to you later.
Come on inside.
It was really nice that when we were done with a process or procedure, then someone would come and get us in a waiting area, guide us to the next step, and tell us what's going to happen there, and then we'd go back to a waiting area. There was always this process of they came with a chart, checked our name, you're who you are, okay, great, and then they would take us to the next spot.
Yeah, they took very good care to make sure we were they thought we were. And because our passport information, our photos were on their tablet, they could come up to us individually and ask us to come with them. So, and before a doctor would do any kind of service or treatment, we'd have to verify our name again. So we felt like it was a pretty fail-safe process.
And the nice part was every time we went to a doctor, they had the information from our previous tests on their system. So it wasn't like paperwork was just being handed around. It was actually on the system. And I felt confident that this doctor was well informed of all the tests and all the information. And there was none of this verbal relay. So what did you do so far today? We didn't have to do that, which gave me a lot of confidence. And one of the tests I had was an ultrasound to check out every internal organ in my whole body. And I've never been flipped and turned so much on a table and had an ultrasound. I mean, I wanted to check to see if I was pregnant because there was so
He's
many.
not.
I'm not. But they went through everything. In fact, at one point, she kept testing one spot when I was on my side. She said, "Have you had gallbladder surgery?" I'm like, "No." She just keeps testing. It's like, okay, I guess I'll find out what that's about later, which they did tell me. And it was really nice to have all those documents and all those ultrasounds and all that stuff digitally sent to us, as well as getting paperwork and reviews by the doctors.
Right. At the end of the day, we ended up getting all of our paperwork in hard copy, but then also emailed to us. And we could also request, and we did, getting all of our lab work as well as all of the actual ultrasounds, not just the medical records.
Right, and the x-rays. So it was nice to have, since we're full-time travelers, having that stuff digital saved me a lot of work of taking photos of every page of these documents with my phone. Because, that gets a little janky, but having these nice packages saying, here's all your health records, so good.
And there were things that, especially for me, I needed to come back for additional appointments. And all of those appointments were being scheduled as we went along. So I didn't have to call and make appointments. So for instance, we said at the beginning that we wanted to have skin screenings. And while we were waiting, they made an appointment for us. Then I had some irregular results from my abdomen ultrasound, and there was an appointment for that, and a cardiologist follow-up appointment. They wanted to do some additional screening, and that was an appointment.
All right, we're out with today's results. We did our talk with the main doctor. We've got a couple more doctors to get specific results from.
Yep, I feel like for the most part, everything came back the way we expected it to. Again, I've got a few more doctor's appointments to see today, so back to back to back to back. This is going to be over the course of a week, and we still also want to get dental appointments as well. So stick around, we got a lot more for you.
Healthcare in Thailand. It's a long day.
Yes, very long. It's 4:45, so we've been here since we've come and gone. We were here for a while this morning, and then we came back after a battery of appointments with various doctors, and I was pleased how quickly they moved us through. Some of it was slow, and we actually were delayed from our appointments, but the concierge that we had just helped to rearrange things, and at one point they just kind of fast-tracked us to see a cardiologist of all people, so it was nice that was able to happen.
It felt like we were going to miss the cardiologist because we moved to the liver appointment, and it's like, okay, now we're going to have to come back tomorrow, but no, they fast-tracked us and made it a little bit easier.
You can't really see it, but I've got some heart monitor equipment on for 24 hours. I think we'll go into it a little bit more detail, but I've had a really low pulse rate. And in some respects, they say that's the sign of an athletic heart. Well, I don't have an athletic heart, but my heart rate has been really low.
Well, the cardiologist said it was better to have it lower than higher, as long as it doesn't stop.
Right. So
and we agreed.
We agreed very heartily. So they're just monitoring me for 24 hours to see what the EKG ends up looking like. So we'll see.
A little bit more tomorrow.
Yes. I'm here on my own this morning, heading into the hospital because I'm supposed to be getting a scan of my abdomen for a growth that is larger, probably twice the size that they'd like to see it be. And so they want me to just come in, get a CAT scan, and make sure that there's nothing to worry about. But the complication comes in that I have all of these wires from the 24-hour EKG monitor that the cardiologist asked me to wear. So I kind of feel like it's going to be a conflict. I called and sent an email letting them know that I thought it would be a problem, and so far nobody this morning has reached out to me about it. So I'm going to show up and see what they want to do. Perhaps they'll take off the monitor and do the CT scan and have it all work out. Who knows? Stay tuned.
So there were maybe two areas that I felt a little underwhelmed with. The first one was that I was scheduled for a stress test. When I was upstairs, I saw that there was a stress test area. I didn't go there, and it could have been that they were too tied up, or I don't even know why. But I ended up going to a downstairs area, and basically I had to walk between two cones, and they took a timer on how long it took. And then I had to do a brisk walk, and they timed that. And nobody checked my breath to see how that went. And so to me, that seemed like a pretty lame stress test. And
More like a sobriety test?
a little bit. So I was intimidated about what a stress test might be, but what that was subpar for my expectations. And I think the other thing I was disappointed with was the eye screening. When we got glasses in Japan, one of the things was that they don't really have an ophthalmologist or even an actual optometrist checking your eye health. They only looked to see what your prescription was. Right. So when we came here, I was really looking forward to getting my vision checked. Kevin gives me a hard time about my peripheral vision. And
he just ignores me, so it doesn't matter.
But it turned out that there wasn't any high-tech equipment. They just kind of did,
follow the finger
exam, and there was no air test into your eyes, right. Not the kind of thorough testing that you get in the US. So
just an eye chart and the finger follow to make sure that you weren't losing peripheral vision, and that was about it.
Right, yeah. So that was a little disappointing.
Yeah.
So I'm here with Kevin now, and we're back to go to the cardiologist and get the results from my 24-hour EKG. And then after that, I'm scheduled to go to the liver specialist so that he can give me the results of the CAT scan that I had earlier. So cross our fingers that everything is a non-issue and we can kind of at least put this part of the healthcare stuff that we had to do to rest.
That'd be nice.
Tomorrow we're supposed to go and get skin checks. I do think that I have something that probably needs to be biopsied and maybe surgically taken care of, but I'm not going to rush that. We'll see what tomorrow brings. Let's get in and see what the doctors have to say.
All right, done for the day?
Yes. And I think overall the results were positive.
No surgeries.
No surgeries. The cardiologist said that my issues are predominantly that I have just a really low pulse. And there was one incident in the last 24 hours where pre-beat, and a couple of situations where maybe I stopped breathing, but for like 1.4 seconds, which they said is under the 2 seconds that they're really concerned about. So just said to be cautious, and anytime I get prescribed medicine, I should let them know that I have a low heart rate.
Also, fainting, dizziness, all those kind of symptoms, maybe get your heart rate checked for those.
Right. And as far as my liver issue and the cyst that I had that was fairly large, they said it wasn't a cyst to be concerned about. So that's reassuring as well.
Nothing to do. Yep. Happy with that.
Yes. It's day 4 of medical checkups, and we're here today at the Skin Center.
Yep, we've got to get our whole body checked for anything that looks off, and Judy wants to make sure that she has no more skin cancer could reappear. So that's a big thing.
Here we go. So we're finished. It's 3 o'clock. We had appointments for 1:40. Yeah, 1:45 and 2 o'clock. So I feel like that was pretty fast.
Yeah.
We both had, I had something biopsied, and
I had precancerous items frozen and a skin tag that was removed.
And I guess just a normal PSA to make sure you're wearing sunscreen. I'm paying for years and years of skin neglect and too many times sitting outside in the sun baking.
And I'm just paying for having Irish thin skin. And yeah, some of my problems are on my scalp that they had to freeze. So they said, wear a hat, which, okay, I gotta find a hat again.
Right. So we both come back next week to get the results of some of the work that they did, and we'll see where we go from there. But overall, cost was pretty affordable for what we had done.
Yep, and it was pretty quick.
So the fact that everything was finished in this appointment, we didn't have to schedule any kind of follow-up, is awesome.
Before we share our costs and our final thoughts, we're excited to share that we've started our own absolutely free community forum that we are calling La Familia. You can ask questions about trip planning and all things related to travel there. A video with the details is linked in the description below.
So what did we spend for all our healthcare costs?
My premium checkup package was $608.77. That included a hearing test and also our hepatitis A and B vaccines.
My advanced checkup package, which also included our vaccinations and my add-ons, was $395.66.
So our total for both of our checkups was $1,004.43.
Judy's heart monitor and consultation with the doctor was $233.73.
My CT scan and consultation with the specialist was $425.65.
And our skin clinic biopsies and treatments were $256.04.
And that's for both of us. So our grand total for all 4 days was $1,919.85.
This total was less than our deductible for our health insurance. So all these costs were out of pocket.
But overall, I think that that's a pretty darn decent price considering we saw several specialists and had additional add-on treatments that would normally be fairly pricey. So over the course of these 3 days, we made a lot of appointments. We talked to a lot of doctors. We had specialist appointments as well as just basic run-of-the-mill testing. What do you think about how all of this went?
I think that overall, the key factors here were that we were always taken care of. We were always guided to our next physician appointment, whatever we had to do. We're guided to another room. They spoke to us in English. They made sure that who we were was who we were on the paperwork, and that there was this urgency to make sure we were taken care of. There was always somebody that they would assign to us to make sure that we didn't get lost going from floor 2 to floor 4 to a different department. And that makes a big difference, along with all our documentation, all our information being in English. That was a little bit of a tricky situation in Serbia where I got my results. They were in Serbian language, and we had to pay to get that translated to English.
Which was a nominal cost, so it wasn't a big deal.
But it was something extra that we had to do, and it took a few days to make sure that got done, which we didn't have to worry about here. Everything was just given to us 2 ways, right in person, here's your paperwork, and sent to us via email.
But it did help to have had that Serbian experience, so I felt like we kind of knew what we could ask for and what our options were.
Were you happy with the way you were treated throughout all these procedures?
Yes, I felt like in some ways it was like very transactional. We moved from place to place pretty speedily. Yeah. I feel like we sat around and waited, but then when they called our name, boom, we were in, and they were very efficient with the time that they spent. But things like the specialty treatments that I needed to have, they told me in advance what the cost was going to be. And I wasn't really concerned obviously, I felt like these were important tests to have, so I wasn't going to quibble over the cost. But overall, I felt like we came out so much more inexpensively than we would have in the United States. Now, granted, we both have high deductibles. We have a $3,000 deductible, and this is January, so we were starting over. But overall, we didn't hit our deductible at all yet.
They did have a cashier section, and every time that we needed to go pay something, we would get guided to the cashier section, given a number, and then when that number is called, we'd go up to a cashier, take care of our payment. And that helped the process too, because we didn't have to think about, are we going to get billed for something? Is there something that's going to be a surprise? You know, it was all up front. It was all explained to us. And even when we were picking these a la carte items like I was, it was explained how much that was going to cost in addition to what we had done.
Right. There were no surprises.
Right.
And we only went to the cashier once a day.
Yes.
So once we were finished with our initial battery of tests, and then the second series of specialists, and then the third series of specialists. So it's not as though we felt like each doctor needed to get their payment. It was done centrally, and that was really convenient.
Like the records, all our financial stuff and all our payments went central and was easy to understand.
So overall, do you feel like there were any downsides to doing this?
I don't know if that's a downside so much because I don't know what our alternatives would have been. I think if we would have had this done in the US, we certainly couldn't have had it done in 3 days with all the battery of tests we had done for the amount of money that we paid here. So the downside probably would be that I didn't know what to expect. And going into this, now that I know what to expect, the next time I probably would say, yeah, this is a good place to get a battery of tests done because of the results and the way the results were delivered. So overall, yeah, no downsides for me. I'm overall very happy with it.
Yeah, I really was super impressed about the fact that, you know, we got all of our blood tests, all of the testing that we had done, we got results the very next day or same day for every single thing, which that is pretty unique. I mean, maybe it happens in other parts of the world, but I've never had that happen in the US. So I was like pretty stoked that you don't have to wait and worry about what your test results are going to be. I mean, even like I wore my EKG monitor for 24 hours. I turned it in and I didn't turn it in. They took it off of me. And then I probably waited less than 15 minutes and had the results of the reading. So that's pretty miraculous.
That's tricky. Yeah, because they have to download that information, then process it and review it. And the doctor was there reviewing it live with us and saying, yeah, this is not a concern. This is a concern, but not too much. You know, I don't know. The doctors, the time with the doctors was definitely impressive. They took the time to explain things. We had questions. They answered them. I felt like some of the technicians might have been a little procedural, you know, but even there, I think they were doing a very good professional job. And that summary, every time we had to sit down and talk to a doctor, was the part that was critical, and I think it was done really well.
Yes. Although I will say it's not like any doctor spent 20 minutes with us or maybe even 15. I feel like they ran through the results fairly quickly, but not any faster than you'd get in the US either.
No, because I've had these kind of results reviews with a doctor before when I worked at Apple in their wellness center. And it was kind of the same thing. If there's anything that stood out, they'd spend a few more minutes on it. Otherwise, they're like, yep, you're good in all these. Any questions? And kind of the same thing here.
Right. I mean, they did go line by line, especially through all of our blood work and what the results meant or the high and low and letting us know that we were in range. So I feel like that was really helpful. And overall, like we're in good health. There's nothing really we have to be worried about. For now, I feel pretty confident that we can both go into the next year not really worrying about much.
Yeah, so I would recommend Thailand as a place to get medical procedures done like this, testing done. I don't know about the further stuff, but I'm really happy with the way they structured everything here.
If you haven't subscribed already, we hope you'll do so. And your best compliment would be to share our episodes with your family and friends.
And check out findinggina.com. Lots of articles. We'll put some more information about our testing as we have it, so you can look that up.
Until next time.
Until next time.